So, good evening, everyone. I'm sorry to be late for 15 minutes because of some technical snag happened here on my side. So, everyone who were coming live 15 minutes back, please rejoin me. Uh, I'm really sorry for some technical issues. Just waiting, people are joining me. Let me chat till then. Evening, everyone. So, all right. So, let me just start with where is Dr. Pooja Pal? Is she there? I told her that I will take her question first. So, I'm not finding still Dr. Pooja Pal. So, let me just begin further without wasting any more time. Uh, Whenever I see her message, I'll take her question, that time. So, what we are going to do today is about the introduction by Dr. James Krauss to the sixth edition of the Organon of Medicine. See, this sixth edition got ready by Dr. Samuel Hahnemann, you know, in 1842 itself, just before his final departure from the earth. But then it did not come. Then somehow, very, very thanks to the noble soul of Dr. Borick, William Borick, who made a great effort to really get this sixth edition of the Organon, the last original writings of Dr. Hahnemann, to really make it available to everyone year 1921. So just see, some almost 8 decades time, this writing was really not available to the world of homeopathy at all. And what do you think that if we really want to appreciate this introduction of the world, especially the scientific world, the medical world, and all this, you'll be surprised that from 1842 to 1921, if you go in the history of this time, especially related to science, biology, medicine, what all has happened, so much of changes, so many changes. तो हमको ये जानना बहुत जरूरी है कि जेम्स क्रॉस के इस एडिशन को अगर हम अप्रिशिएट करना चाहते हैं, तो हैनमिन के इस राइटिंग के लिखने और चले जाने के बाद, और जब ये राइटिंग हमको अवेलेबल हुई 1921 में, जो ये करीबन करीबन ए टू डिकेड्स लेस इन 1 सेंचुरी का जो टाइम था, करीबन 80 साल का जो ये समय था, इस समय में पूरी दुनिया में जो साइंस, बायोलॉजी और चेंजेस, what all, I just give you some example. After Hahnemann, the new branch of psychology started 1879. Then in this period, लुइस पास्ट सबसे बड़ा काम जो लुइस पास्चर का था वो ये था कि बीमारियों के मामले में जो माइक्रो ऑर्गेनिजम्स, जो आज हम इन्फेक्शियस डिजीजेस की बात करते हैं, उसको साबित करने का काम उन्होंने किया था ऑलमोस्ट समवेयर नियर द एंड ऑफ 19th सेंचुरी, 1890 के बाद। तो ये काम एक बहुत बड़ा काम था लुइस पास्चर का। और जैसे ही 20th सेंचुरी की स्टार्टिंग होने लगी, 1901 ऑनवर्ड्स, इसके ऊपर बहुत काम होने लगे। सो मेनी वर्क, you will be able to appreciate of the work related to infectious diseases, especially the invention of uh, antibiotics. Definitely that came after 1928 only. But then this was a landmark work. Then, as this 20th century was starting, the physics also changing. The classical physics of Newton now going into the next phase of modern physics. And what is that modern physics? It is about the quantum mechanics. Quantum mechanics has lot of effect on so many understanding about the universe, about the industrialization, about so many things, including medicine. Even earlier classical physics impact was so much on the medical world. Similarly, I'm saying all this that unless you really appreciate these 80 years, you cannot appreciate in Boston, you really can't really appreciate the introduction to the sixth edition of Organon. And once you are able to just keep this idea behind of this 80 years time, the history of this 80 years, you will be appreciating how this sixth edition's introduction by James Krauss is appreciable. How he established the work of Dr. Hahnemann in the era, in the time, when things, the science of every type was getting consolidation. ऐसा समय जबकि जितनी भी साइंस की नई नई बातें, मेडिकल साइंस की नई नई बातें पता लग रही थी, वो इस 1900 के बाद का जो एरा आया, 20th सेंचुरी का जो एरा आया, फर्स्ट क्वार्टर ऑफ 20th सेंचुरी आया, कहीं अपनी एक शेप लेकर के ह्यूमन रेस के बेनिफिट के लिए कुछ ना कुछ करने लगी थी वो नॉलेज। तो इसी तरह से मेडिकल साइंस के अंदर भी एक कंसोलिडेशन स्टार्ट हो गया था। बट एक बात हमेशा से देखने में आती है कि मेडिकल साइंस 80 साल के अंदर भी उतना रिकॉग्निशन नहीं मिल पाया। ये एक डिफिकल्टी थी। तो ये सिक्स एडिशन अंदर के वो पूरे मेडिकल वर्ल्ड को ये बता सके कि हैनमैन का काम कितना इम्पोर्टेंट, कितना एक ऐसा ग्राउंड पे किया हुआ काम था मेडिकल साइंस में, जिसको कि हर तरह की पूरी इंपॉर्टेंस दी जानी चाहिए थी। बट कहीं ना कहीं कुछ ना कुछ कमी थी, उन्होंने उसी को एस्टैब्लिश करने की कोशिश की है। तो फर्स्ट ऑफ ऑल, आप अगर इस इंट्रोडक्शन को अपनी अपनी बुक में खोल लें, सबको मिल गया होगा अपनी अपनी किताब में, इंट्रोडक्शन टू डॉक्टर बोरिक्स ट्रांसलेशन ऑफ सिक्स्थ एडिशन ऑफ हैनमैन्स ऑर्गेनॉन। So how many pages? 5 pages. Any kind of footnote. I'm just finding some problem with the connection. Too much trouble in listening you, and in between connection is lost. Okay, so sometimes some net issues may be there. Just give me a moment. Let me just see if it is really doing well. I'm just seeing it. Hmm. So this is a problem on my side. I understood where is the difficulty. I'm just correcting it. Hello, everyone. Now, just tell me if you can really hear me well. Can you hear me well now? So, all right. I will be, in just couple of minutes, I will be repeating what I was saying. See, uh, we are discussing about the sixth edition Organon's introduction given by Dr. James Krauss. So, in this Dr. James Krauss introduction, what we are finding some. It is of 5 pages and 13 paragraph, 190 lines, and it does not contain any kind of footnotes. And I was telling before that whatever you are reading on sixth edition had been kept ready in the year 1842. So it is almost a time of about 80 years. In this 8 decades time, lot many changes occurred in the science, in the medical. Say every one of you that you should be some, just go through some kind of history of this era. So sometime you really need to understand somebody uh, after really knowing the background. इसकी बैकग्राउंड को जानना बहुत ज्यादा जरूरी है. इस पूरे 80 साल की बैकग्राउंड का is really saying about causes the issue. Let me just stop it here for a moment. Just bear with me. So I just continue. Anyway, I'm just waiting. I'm just told to fix the internet queue. In the meanwhile, let us use this time. If you have any questions, you write me. I'll write you the answer back because you can't listen me, but then we can really chat. So let us chat. Just write your questions. Pooja, please see your question. Should our So I think my voice should be clear to all of you. Could you please write me back that you can really listen me well? So let us start. Today, some issues on my side, on the internet side, and all. Sometimes it really happens. We are dependent on technology nowadays. Okay, good. So now, Pooja, let me take your question, and then we'll go ahead with the sixth edition introduction. So the question was: everyone should listen this. That fourth edition preface of Henneman in the first paragraph, some 17th, 18th line, for should our vital force have its integrity impaired? For should our vital force, it means that suppose if our vital force gets affected, it's a kind of model noun. This should, which is used, is a type of model noun. So this is what something important to understand in this question, Pooja. That should is a kind of model noun in which the meaning goes like this: that when our vital force is getting affected from what? From the outside kind of morphic agents, then what kind of behavior it is doing? Vital force is instinctively trying to react it back, which in itself is a disease. This is what is the meaning. You just try to find out the meaning of should. It is a kind of model noun. So, with this, I think you should be clear about it. You try yourself. If anything, you can ask me the question again. Then one Vinita Goyal is asking a question. I will take your question just little later. Let me just go ahead with the introduction to the sixth edition by Dr. James Krauss, because very important, and we really need to uh, understand it. So I am just finding that this my net issue is now fixed, and you all are able to listen me. So I'm just going to start my talk on this introduction of James Krauss again. Just two or three persons write me if you can really hear me well now. Looking for your messages. Are you able to listen me? So, all right. So now I got, thank you, Vinita Goyal, loud and clear. So, all right. Okay. Let me just go ahead with this. So, I was talking to every one of you saying this, that if you really want to understand James Cross introduction to the Organon, you all must please go back and just see 1842 to 1921, this period. What kind of development happened, in the science, in the medical science, the physics, and rest of the other areas, especially which are, somehow related with the medical art. So lot many changes occurred. Some important one I just say you again. Louis Pasteur, who really break through into the understanding of how microorganisms are making us sick. And similarly, with the 1901 onwards, the concept of modern physics came up, quantum mechanics, and like this, so many other changes. And the most important is the uh, political issues. After 1901, this 20th century saw two world war, and this edition survived, out of the two wars. One war was among, the countries in the Europe, and the second was First World War. First World War was from 1914 to 1918, around this period. You can just check up, with the Google, that this is the period. And somehow Dr. Boric thanks to his noble soul, that he could survive this text to us and he translated for us. And on that, he got this introduction. Pages, 13 paragraphs, and 190 lines, and does not contain any footnote. And the first paragraph goes like this: the excellence of Dudgeon translation into English of fifth German edition of Hahnemann's Organon is thoroughly maintained throughout this English translation of sixth German edition by Dr. William Borick, to whom the medical profession is under a double debt for rescuing this last authentic work of Hahnemann from possible loss and for putting it into good, clear, unparaphrased English. So, see, he is first of all, like for example, you take it that some book comes to you and somebody asks you that I am the author or I am the translator, and now you read this new book and please write some introductory remarks on it. So that is how thing came to James Krauss. So first of all, he saw the edition, he saw the previous edition, and he made a very good comparison between the translations concept, like the kind of English and the kind of technicality of the language used. It was very much intact as per the Dudgeon's translation, fifth edition of Dudgeon's translation. And he is congratulating Borick and saying all of us that we have double debt on us, of Dr. William Borick to getting this edition survived the two wars and all those things. And he is mentioning, the years of the war, as I was telling to you. So this first paragraph itself says that last 80 years happenings, you must go into the details of it by Google. तो इसलिए ये एक बहुत जरूरी बात है कि आप जरूरी है. Coming to the second paragraph. Here, this paragraph I earlier also explained, in my the lectures on anatomy of Organon I talked on. So here, what will you find? You will find he is giving an over kuch hua hai. So all these happenings he summed up in one paragraph. This is the beauty of James Krauss. एक पैराग्राफ में उन्होंने सारा कुछ समराइज कर दिया आपके लिए, and made us to go, to read the history of medicine in detail. We need to really justify this paragraph of James Krauss, जहां पर उन्होंने पूरी की पूरी हिस्ट्री ऑफ मेडिसिन को एक पैराग्राफ में इकट्ठा करके रख के हैनमैन को एक ऐसी जगह में रख दिया जिसको कि हम अपने आप से शायद ऐसे सोच नहीं पाते कभी भी, जैसे जेम्स क्राउस ने सोचा है. We would have never thought that what actually should be the position of Master Hahnemann. So he says that in the medical history, whatever maybe the people have done, only 4 personalities we must remember. They are the most conspicuous persons, in the whole history of medicine, according to James Krauss, and really it is. First one is Hippocrates. Second one is the Galen. The third one is the Paracelsus, and the fourth one is Hahnemann. So now with these 4 names, what kind of words he has used? Why is the epochal figure, all these epochal figure? Let us know from him of extraordinary discovery, which compels the whole scenario to be changed. The whole thinking of the era changed. The whole effect is such that your way of thinking completely takes the other way round. So that is called epochal figure. You can check up with the meaning of epoch-making figure. So everything that Hahnemann ever wrote is of historic medical interest, for notwithstanding all attempts of ignorant, prejudiced, time-serving, so-called medical historians to detract from Hahnemann his historic importance for medicine. Hahnemann remains one of the four epochal figures in the history of practice of medicine. The first one is Hippocrates. Why? Because the observer, he was the observer who finally made the art of medicine a kind of natural science. He he just cut off the medical, it is not some kind of wrath or some kind of punishment. So this is how Hippocrates, and we all understand Hippocrates is known as, that is why he is known as the father of medicine. He made the subject medicine as science. It was somewhere 460 500 BC. Then, because Hippocrates finally said, if you really want to understand the medical issues, you should understand it by your senses. That means by clinical examination. And this is the one very, very important thing Hahnemann had been stressing, throughout his writings about the sensible phenomena, knowing the symptoms by its sensible phenomena, not by parasensible phenomena, something beyond senses. He always said diseases can be understood by your senses. That is something very important. That is what, he is again and again teaching us, the most important thing given by Hippocrates. Then comes Galen, the disseminator. Why? Because he spread the powerful authority of the teachings of Hippocrates. Hippocrates gave two most important laws, the law of similia and the law of contraria. Galen could really disseminate, he made it very, very popular. The second one, the law which is based on opposites, contraria. It was, those days with Galen, many of his obvious reasons, though knowing the law of similia, he could really, disseminate the law of contraria only. But then for almost 1500 years, Galen really spread this concept of contraria given by Hippocrates. That is why he is known as the disseminator. Then comes, 1400 AD onwards, Paracelsus, the assailer. He is the one who really condemned the concept of Galen and brought out his own chemical understanding as well as physical analysis of practice of medicine. But the most important thing he did, that he was the most bitter kind of, critic of the concept of Galen. Then comes Dr. Hahnemann. Hahnemann, the experimenter, discovered the symptomatic source of both pathologic and therapeutic diagnosis, and thereby made the practice of medicine scientific. See, he's given the place of experimenter the most important place. And he said that he really experimented in such a way that he was not only able to tell the understanding of the disease by the senses, that is by the symptoms, but then at the same time finding out its treatment, its remedy, by understanding the remedies, the medicines by symptoms. That means by proving the medicines on the healthy human beings, knowing the symptom picture of the medicines, knowing the symptom picture of the disease, and found out that on the law of similia he made a matching and he was able to give a law of cure to all of us. So such kind of experimentation, Hahnemann did not only say this, rather he made us to do this. He did himself, he made us to do it. That is why, he named him as a experimenter. तो ये 4 लोगों ने कुछ इस तरह का काम किया, इस तरह का नाम दिया कि हिप्पोक्रेटिस को उन्होंने कहा कि ये एक ऑब्जर्वर है, ऐसा जो कि एक ऑब्जर्वेशन की साइंस को अच्छे से समझा पा रहा है। इसके बाद में गैलन, जो कि जिसने कि इसको बढ़ाया, इसको बढ़ावा दिया, गैलन के लॉ ऑफ कंट्रेरिया को, उसको बहुत बढ़ाया, बहुत ज्यादा उसने उसको फैलाया। इसी तरह से जब पैरासेल्सुस आए तो पैरासेल्सुस ने क्या किया, उन्होंने गैलन के बढ़ाए हुए काम का एक बहुत बड़ा क्रिटिसिज्म किया, उसका उन्होंने बहुत बताया कि ये कितना गलत है, इस तरह से इलाज नहीं होना चाहिए। और हेनमिन को उन्होंने कहा कि इन्होंने जिस तरह का एक्सपेरिमेंट किया है, जिस तरह का इन्होंने प्रयोग किया है, ऐसा प्रयोग करने वाला पूरी हिस्ट्री ऑफ मेडिसिन में सिर्फ एक ही व्यक्ति है, जो कि दवाइयों को प्रूव करके उसको उसके सिम्टम्स के तरफ से जाना, बीमारियों को उसके सिम्टम से जाना, और दोनों के सिम्टम को लॉ ऑफ सिमिलिया पे मिला करके जब दिया तो उससे पेशेंट ठीक होने लगे। इस कारण वो एक बहुत बड़ा प्रयोगकर्ता हो गया। इस तरह से जेम्स क्रॉस ने समझाया है हमारे को डॉक्टर हेनमिन के बारे में, और ऐसा हिस्ट्री ऑफ मेडिसिन का हमारे सामने एक निचोड़ रख दिया है कि अगर इस एक पैराग्राफ को अगर हम जस्टिफाई करने के लिए जाएंगे तो मैं आपको बताना चाहता हूं कि आपको बहुत सारी किताबें हिस्ट्री ऑफ मेडिसिन की पढ़नी पड़ेंगी, और बहुत अच्छी अच्छी किताबें हिस्ट्री ऑफ मेडिसिन की अवेलेबल है, बहुत अच्छे अच्छे ऑथर्स की किताबें अवेलेबल है अगर आप ढूंढेंगे तो ये सब बातें हुई। देन कमिंग टू द थर्ड पैराग्राफ, व्हेन यू टॉक अबाउट द थर्ड एंड फोर्थ पैराग्राफ, in these two paragraphs, James Cross has explained, about the allopathic science, allopathic art of practice of medicine, and all those kind of things, how in allopathy we understand the disease, and how in allopathy we give the treatment. See, I just read a few lines, they worth reading lines by James Cross. In the scientific practice of medicine, we examine even patients suffering from any of the, उसने diseases को 4 शब्दों में describe कर दिया. He described, the diseases in just 4 words. Only 4 type of illnesses we understand. What? We examine every patient suffering from any of the topic, means local, means on the skin. Plastic means any internal organic changes. Trophic means any kind of because of nutritional things. And toxic means any kind of poisoning diseases. So diseases can be either topic, plastic, trophic, toxic. So to which man is subject in order to obtain all the signs and symptoms of disease, all his disease effects for pathologic, therapeutic diagnosis and prognosis. So they go, into the further pathological changes occurring because of all these. Stick means organ में होने वाले changes हो जाने के बाद जो बीमारियां होती हैं, जिसको कि हम ट्यूमर्स भी कह सकते हैं, अल्सर्स भी कह सकते हैं। इसी तरह से ट्रॉफिक मीन्स रिलेटेड टू द न्यूट्रिशन, जो भी आपको डेफिशिएंसीज और एक्सेस ऑफ द फूड के कारण कोई बीमारियां होती हैं, ये वो वाली बातें कही जा रही हैं। Then coming with the next word, that is toxic, that you understand, जो कि पॉइजनिंग से होने वाली कोई भी बीमारियां हो जाती हैं। तो इन सब बीमारियों के अंदर वो उसके डायग्नोसिस में जाते हैं, उसके प्रोग्नोसिस में जाते हैं। जब वो डायग्नोसिस में जाते हैं तो वो उसका एनाटॉमिक डायग्नोसिस करते हैं और साथ साथ उसका फिजियोलॉजिक डायग्नोसिस करते हैं। व्हेन आप जब उसको एनाटॉमिक डायग्नोसिस कहते हैं का मतलब शेप में होने वाले चेंजेस, और जब आप उसका फिजियोलॉजिक डायग्नोसिस कहते हैं तो आप ये कह रहे हैं कि उसके फंक्शंस में होने वाले चेंजेस। When you go into the diagnosis, it covers 2 things: the anatomic changes, in the shape of the organ or the part happening is anatomic diagnosis. And if suppose whatever may be the illness, whenever there are some kind of functional disorders, functional alterations, that is called the physiological diagnosis. That means what you talk diagnosis from the allopathic point of view, in that these two things are the most important one, must be reflecting, that it must be showing you in the diagnosis what kind of changes in the shape and size of the organ has occurred, and then along with this what are the functional alteration has occurred. Until and unless any diagnosis not telling about you these anatomic and physiologic alterations, you cannot say it a proper diagnosis. So this is how he explained in that. Then we diagnose the etiologic factors, how all this has happened, maybe a developmental one, maybe a traumatic one, maybe the infectious one, and like this you just go on doing that. And along with this you diagnose the therapeutic application, the modalities for the treatment. तो आप किस किस तरह के डायग्नोसिस कर रहे हैं, आप एनाटॉमिक डायग्नोसिस कर रहे हैं, आप फिजियोलॉजिक डायग्नोसिस कर रहे हैं, आपने इटियोलॉजिक डायग्नोसिस किया, और आपने थेरापेटिक डायग्नोसिस किया कि किस तरह की दवा देनी है, शेप में क्या चेंज आया, उसके फंक्शन में क्या चेंज आया, वो किस कारण से आया, हम क्या दवा दे सकते हैं. ऑल दीज थिंग्स वन शुड बी talking about if you really think of the allopathic point of view. When you talk therapeutic, it covers any kind of prophylactic, any kind of diet regimen, that is what may be the hygiene, what will be the sanitation required, and all those kind of things, so that the preventive aspect must be covered. Then in the fourth paragraph, again, relating to the allopathic science, what is he talking? He is talking in this paragraph the ultimate effect of allopathic kind of therapeutic modalities. What are the actual impact, happening because of the allopathic treatment modalities. The treatment of patients subject to malformation, malposition, malnutrition, injuries, foreign bodies, traumatic and infections, inflammations, new formations is effected with medical चाहिए वो दिए जाते हैं. अब उनके सबके किस किस तरह के इफेक्ट है. सर्जरी की तो उस सर्जरी से वाकई कोई